Hi, I'm Jonathan Reimer. Welcome to Smart PT. This week I'm going to be talking about pelvic issues in the form of torsions or rotations. We do have to deal with upslips quite often, but that's a little more complex, and I will teach you how to deal with those things in my training course. I might actually even post a video about it in the future, but right now I want to talk about what happens when a patient comes in and they have a pelvic torsion. The most common thing we'll see is a right anterior rotation. Similar to the depression and protraction we often see in the dominant arm, we'll often see an anterior rotation on the dominant side. Also, just from a frequency of movement and reaching type patterns, we create that adaptive type of change. Now, some people don't think that's an issue. They say it's an adaptive change and just let it be. But I always think postural symmetry is very important. So if you don't have symmetrical alignment of joints, you're messing with length-tension relationship issues of muscle, and you're kind of getting abnormal activity from the muscle. Also, oftentimes you'll get a guarding response. Muscles, when they sense that something's not moving right, or the movement pattern or the position that's in is causing stress, they're going to respond by tightening. So you'll get patterns of tension and weakness developing, not only because of length tension, but because of the natural defense mechanism of the muscle. So I find it's very valuable and useful to restore symmetry. It resolves a lot of back problems. A lot of people treat the lumbar spine without addressing the sacroiliac joint issues first as well, and I think that's a bit of a mistake. I think that if a pelvis is anteriorly rotated or posteriorly rotated on the side, the sacrum will turn towards the posteriorly rotated side or away from the anteriorly rotated side, and in kind it will twist the lumbar spine. So it's very difficult to sustain any kinds of improvement in lumbar mobility or symmetrical alignment if you don't first address what's going on in the pelvis. So what do we do for that? There's techniques to manually rotate the anterior pelvis backwards, but I want to teach you a simple exercise today that can be used. Again, you can take a course like Smart PT or the orthopedic div levels to learn how to deal with the manual adjustment of a pelvis, but today I'm going to teach you a post-treatment exercise. Before I do that, real quick, I want to talk about what you'd expect to see. So if you have an anteriorly rotated pelvis, on the right side, for example, you would expect to see the ASIS a bit down and the PSIS a bit up compared to the contralateral side. Also, potentially, that might be happening with a posterior rotation on the other side. So then what I look at is also the degree of lumbar lordosis. Do they look like they're anteriorly or posteriorly rotated? Are they flat or excessively lordotic? That might give me a little bit of a hint as to whether they seem anterior or posterior. But I would say the most common pattern, I see anterior rotations on the right most commonly. So how would I deal with that in the clinic? There's a very simple exercise. You're going to lie on your back. You're going to use isometric hip extension on the right side and hip flexion on the left side. You can do that simultaneously, hold for about 5 seconds, and keep repeating. So normally I'll do some back stretches first. Get rid of the QL tension, glute max tension, piriformis tension, potentially hip flexor also, and then I'll ask people to finish their exercise program with that exercise. Typically do about 5 to 10 repetitions, 2 to 3 sets. How does it work? Basically use the isometric action of the gluteus maximus. Now normally the gluteus maximus is a hip extensor, so we'd expect it to potentially drive anterior rotation, but because we're blocking its action at the distal part of the extremity, we're causing it to reverse its action and instead pull the pelvis posteriorly as opposed to moving the femur posteriorly. So it has that reverse action when we do an isometric exercise of that nature. So hopefully you find this helpful and you can use it in your practice. Check us out on smartpt.ca or on YouTube.